Welcome! This is the first part of our video wherein you will learn the proper procedures in assisting the elderly in shower bath, changing the dress of the elderly, assisting patient who is able to brush teeth, and lastly, assisting nurse with proper preparation and administration of oral medication. The purpose of bathing the elderly is that it helps your patient to avoid skin breakdowns and infections. The first procedure is assisting the elderly in shower bath. Prepare all the necessary equipment and supplies needed for smooth carrying out of the procedure. We have the bath towels, shampoo, soap, washcloth, chair with backrest or support. Knock the door 3 times before entering the patient's room as a sign of courtesy. Greet the patient and introduce yourself. Verify the patient's name by checking the ID band or the wristband, or you can also check the name on the headboard or the name on the footboard. Before doing this procedure, make sure to check the doctor's order, just to assure that your patient is allowed to take a bath. After that, go ahead and get the vital signs of your patient. Make sure that your patient has no fever and in good condition. After preparing all the equipments and supplies, proceed in preparing the shower stall. You need to test the faucet or the shower function. Place the rubber mat on the shower floor and the chair over the rubber mat. Place the chair and bath mat outside the shower stall. Prepare the bath blanket that you will use in covering the patient after the shower. This is to maintain cleanliness and safety for the patient. Assess the readiness of the patient and explain the procedures. Assist the patient to sitting position on the side of the bed. Help your patient to stand. Accompany or transport client to the bathroom and offer slippers. Showering or bathing will be tiring. Transportation in a wheelchair will conserve energy, and assisting the client will avoid slipping. Help the patient to sit down on the chair outside the shower room. Hang occupied or any sign before using the bathroom. Client needs privacy while bathing, but shower door should not be locked so that the caregiver can come to assist the client as necessary. Help the client into the shower room and sit on a chair providing necessary assistance. Turn on the faucet and adjust the water temperature. Let the patient check. Always remember to provide safety for your patient. If the client is showering independently, check on the client within 10 to 15 minutes. Stay close to shower opening. Turn off faucet. Offer bath blanket to cover herself. Help client out of the shower. Turn off faucet. After helping the patient, return to the shower room. Clean the shower room according to the agency policy. Discard the soiled linens. Place an occupied sign outside the door. Return articles to proper places. Maintain cleanliness and good infection control practices. After discarding the soiled linens and placing the unoccupied sign, make sure to wash your hands. Make sure to record and report everything that you notice or you observe from your patient. We will proceed in assisting elderly in changing clothes. Maintaining good personal hygiene is vital in preventing ill health. Dressing can impact an elderly individual's self-esteem. Before changing the clothes of the elderly, make sure to wash your hands. This is one simple activity that prevents the spread of microorganisms. Bring clean hospital gowns to bedside for smooth carrying out of procedures. Raise patient's shoulder from bed as much as needed to locate the ties or snaps at the back of the patient's neck and unfasten the gown. Take gown sleeves off the arms but leave it across the chest for the time being. Place clean gown over and slightly lower than the used one. Put the sleeves by placing your hand through the clean gown sleeve and gather up. Then, still holding it so, gently grasp the patient's hand or wrist. Still holding the gathered sleeve, use the other hand to pull sleeve into position. If the patient has disabled arm, place the sleeve on that arm first. Sometimes patients speak of their bad arm, which may only mean that it is stiffer than the other. Consider it as disabled. Give particular attention to look for these articles. They might be cheap or common items, but very valuable to the patient. Before changing the clothes of the elderly, make sure to wash your hands. This is one simple activity that prevents the spread of microorganisms. The next procedure is assisting patient who is able to brush teeth. Brushing the teeth of the elderly will help them to prevent gum diseases and tooth decay. Elderly people should use a soft to medium toothbrush. You may have to remind them to replace it when it gets out of shape. Prepare all the necessary equipment and supplies for the smooth carrying out of the procedure. We have the towel, straw, toothbrush, toothpaste, cup, mouthwash, basin, wipes, and tissue. Raise the head of the bed to place the patient in sitting position to prevent aspiration. Protect the patient gown and bed with a towel. Give the patient an opportunity as often as time permits to wash her teeth after she eats. Do not let the patient rely on caregiver. Give assistance if needed. Do not perform all the procedures for the patient unless he cannot really do it. If the patient cannot sit up, he or she may be able to wash his teeth anyway. Turn the patient on his left or right side and supply him with articles needed. Rinse the toothbrush under running water. Most oral preparations are taken by mouth, swallowed with fluid, and absorbed via the gastrointestinal tract. Simply put, not taking your medicine as prescribed by a doctor or instructed by a pharmacist could lead to your disease getting worse, hospitalization, even death. Assist medication nurse in the unit in transcribing confirmed doctor's order to individual patient cardex. Then, preparation and transcribing of medication card as per institution standard frequency, color coding per patient based on the content of the cardex. Here is the sample of a medication card content. It must have the name of the patient, room and bed numbers, date ordered prescribed, name of the drugs, right route, right dosage, time of administration, name of nurse who transcribed the medication card, And lastly is the name of the prescribing doctor. In preparing the tablets, pills, and capsules, you must read the label, remove the cap, and gently shake the prescribed number of tablets or capsule. Place in a medicine glass and return the bottle to the shelf. Place the medicine glass with tablet or capsule at the top of medication card for specific patient. In preparing the liquid medicine, first you must read the label, then shake the bottle. Open the cap and pour the medicine along unlabeled side of the bottle to the medicine glass at the eye level. This is to keep the bottle from getting stained with medicine. Next, wipe the rim of the bottle with a clean piece of cloth or tissue and replace the cap at once. Then, return stock bottle to the shelf. Put the medicine glass with medicine on top of the medication card. Properly identify the patient based from the medication card and state your objectives. Give the medicine and stay with the patient until the medicine is consumed. Leave the patient comfortably, wash your hand, and document the procedures that you've done.